Okay, you're on.
Okay, good evening, everyone. My name is Frances Curtis, and I am the chairperson of the Subcommittee of Quality of Work Life's Subcommittee of Human Services. And today we're going to have a special presentation on an introduction to viruses and vaccines, and also discussions about the variants and all the other things that we've been seeing in the media that have us going crazy. And we have two excellent doctors that are going to give us an introduction and an overview to help allay some of those fears that we may or may not have. So without further ado, I would like to introduce, and then after their presentation, or when they give you a little bit about their background and stuff, that you should let us know whether you want to take questions in between or whether you want to hold off until the end. That's what I forgot to ask you in the beginning. But may I present to you Dr. Monica Guzman and also Dr. Banki Fabimi.
Thank you very much, Francis. And first of all, thank you for the opportunity to have us here to present and provide some information about viruses and vaccines, and of course, with a specific focus on COVID-19. My name is Monica Guzman. I am an associate professor here at Weill Cornell Medical College. My laboratory focuses on cancer, and we do also some work on immunology and immunotherapies. And I'm here with Banki. Banki, do you want to introduce yourself?
Sure, thank you. Thank you both. My name is Banki Fabimi. I am the Business Development Director at the New York Genome Center, which is a nonprofit academic research institution in New York. We have our own faculty that do a lot of great work on genomics research, and we actually have done a lot of work on COVID research as well. And I'm glad to be here presenting with Monica. Monica and I are both involved in a vaccine advocacy group that was put together by a number of great researchers from Sloan Kettering and a couple of other institutions. And we're part of this group, reaching out to the community to, inform them and educate them more about vaccines.
Yes, and please feel free to ask any questions or concerns that you may have. We'll try to do our best to address all your concerns. So to begin with, you might all wonder how many cells the human body is made up. And this is something that is actually quite fascinating, because if we think about it, our body is composed of 30 trillion human cells. And why do I refer to human cells? Is because we also have around 39 trillion of microbial cells. And microbial cells will represent bacteria, viruses, and other germs. I know that sounds astonishing, but yes, our body also contains a lot of these microbial cells. And what are these microbial cells? One of them is bacteria. And bacteria are single cells that can survive on their own. They can divide on their own, and they can cause disease in humans. However, we cannot live without them, because we might have, and we have, bacteria, for example, in our gut that help us process food and other functions. So some bacteria is critical to our daily life, and it's important to consider that. In addition, viruses are much smaller than bacteria. They're around 1/100 of the size of a bacteria. What is interesting about viruses is that these are infectious agents that they need a human or any other host cells to survive. So on their own, they cannot do much. And on their own, they exist as what is known as variants, and they can live outside a cell just as a particle. And also, you might wonder how many different types of viruses are there. And this is quite an impressive number. As you can see, it's 10 times the 31. So it has 31 zeros. When we were talking about our body, the number of cells we have in the body is 30 trillion, which means 12 zeros. We're talking about 10 nonillion types of viruses that are out there. I know that sounds scary. However, when we put it into perspective, only around 200 of these viruses can infect humans. So it's a very small proportion when we think about all the viruses that have been identified out there. Only 200 could infect humans. And also to put things into perspective, I want to show you this this slide or this video that represents the sizes of many things we're going to discuss today relative to things that we see in our daily life, so we can put things literally into proportion. So here we're comparing the font times regular 12 point, a coffee bean, and a grain of rice. So when we think about these common things that we probably encounter in our daily lives, we start seeing other things. For example, a grain of salt, an amoeba, a skin cell is much smaller, a red blood cell. And when we go even smaller, for example, yeast. And here is the bacteria that we were talking about before. And what, like we said, 10 times even smaller than this, we can see the viruses. Even smaller than viruses, we can find parts of cells, for example, a ribosome, RNA, antibodies, which is something that we're also going to mention today. And the smallest thing that we can think of is going to be a carbon atom. And the size of this is 340 picometers. So it's very, very tiny. But when we see the things into proportion, even an antibody is much smaller than a virus. So when we talk about viruses, we need to think about how a virus will spread, because we said that cannot live on its own, so it needs to be jumping from human to human. So one of the ways is when we sneeze or cough, we create this cloud. And this cloud will contain the viruses. And it has been shown that as far as this can travel is around 6 feet. That's why when we talk about social distancing, that magic number is 6 feet, because that is the number that has been shown that a virus can spread when a person sneezes. That's why it's important to wear a mask, to minimize the reach of that cloud. And it's more important when two people wear the mask, because we minimize the spread and we minimize the contact. So, but yes, all of that is scary, but we also have an immune system. And how does this immune system work? So our immune system, or our blood, in our blood, we have what is called white blood cells and red blood cells. White blood cells play a very important role because white blood cells are our immune cells, and their job is to find infections in our body with the purpose to eliminate them. So these are pretty much our trained soldiers that we have in our body, which their job is to identify foreign objects, for example, in this case, a virus. And then once they identify that this does not belong to your body, it will pretty much either eat it or eliminate it. And that's the way our body can fight germs, which will include the viruses. Another way that our body can fight these viruses is with antibodies. So it's a way our body can remember that we already encountered something bad. So once we encounter something bad, our body generates these antibodies. And these antibodies is another way to eliminate things that we have encountered. And the way the antibodies work is they identify this foreign object, they surround it, they call other immune cells again, and it's going to get eliminated. So that's where vaccines come, and vaccines are very important, because the role of a vaccine is to accelerate or help our body to create these antibodies. And this is a very important process because our body doesn't need to encounter this foreign virus, for example, in order to create antibodies, because, for example, in the case of COVID, the reaction of your body might be too severe in order to have enough time to produce these antibodies. So the way that vaccines are generated are very different ways. And I'm going to give you some examples of how historically these vaccines can be generated. One of them is what is called heat inactivated virus, or virus killed by heat. So what is done is researchers take the virus, they kill it, and just the dead virus can be injected in a person in order to generate these antibodies. Another way that this can be done is by just using little parts of this virus. Again, is put into the body, and these viruses are going to be used to create these antibodies. And finally, a newer way that we have all heard about is using messenger RNA. And what messenger RNA does, it provides it's a recipe to the cells so they know how to make this just a tiny part of the virus. And this tiny part of the virus it doesn't have an actual function on its own, but the only thing it's going to do is train your cells to make these antibodies. So when you encounter the virus, you can fight it. And what is important is that human cells will create these particles or these little parts of the virus, but it's only temporarily, while your body can generate the antibodies. It's not going to be forever. So what does happen with these tiny pieces? How does it work? So these little pieces, or the hit inactivated or the mRNA, are known to generate what we call antigens. The antigens is what the cell is going to encounter in order to be able to make these antibodies. And once your body starts making and producing all these antibodies, then your body is going to be ready to fight all these germs or these virus and eliminate it quickly upon encounter.
Great. So I'll continue from here. Thank you, Monica. So I think what I'm going to talk about next is really the process for how these vaccines go through the clinical trial process for approval, right? So before any kind of medication, whether it's a drug or in this case a vaccine, is available to inject patients, it has to be approved by the regulatory authorities, the FDA. And for these vaccines in particular, we started with phase 1. And in all drugs, you do phase 1. Phase 1 is done in healthy volunteers. For the vaccines, it was about 20 to 100 healthy volunteers. They're injected either with the vaccine or the placebo. It's important to note that they don't know whether they're getting the vaccine or the placebo. It was double-blinded, so even the healthcare provider who's injecting them doesn't know if they're getting the vaccine or the placebo. And the questions that researchers are trying to answer in phase 1 include: 1, is the vaccine safe? Next, are there any serious side effects? How does the vaccine dose relate to any side effects? And is the vaccine causing an immune response? So at the end of phase 1, the data is reviewed, and if the answers are satisfactory, the drug moves into phase 2. And I just want to note for you guys that there are actually 2 candidates that were dropped in phase 1. Merck had 2 vaccine candidates for COVID-19 that did not make it through phase 1. So not everything was approved, right? And so if it's approved, it moves into phase 2. In phase 2, you're looking at several hundred volunteers. And the questions researchers are trying to answer in phase 2 are: what are the most common short-term side effects? What is the body's immune response? And are there signs that the vaccine is protective? Once again, the data is reviewed by the authorities, and if it passes, the drug moves into phase 3. Now, phase 3 trials are really large. It says in the thousands, but actually for the COVID vaccines, it was in the tens of thousands, and I'll show you that on subsequent slides. And the questions that we're trying to answer in phase 3 are: how do disease rates compare between people who get the vaccine and those who did not? And how well can the vaccine protect people from disease? And so once this data is reviewed and the answers are satisfactory, the vaccine is approved. It's important to note the FDA approves a vaccine only if it is safe, effective, and the benefits outweigh the risks. And it's important to also note that researchers continue to collect data on the vaccine's long-term benefits and side effects. And so if you click on Monica, and so in the case of the COVID vaccines, they were approved under a much faster timeline. And they were approved under the Emergency Use Authorization, or EUA. This was done in this case because we are in a global health emergency. We're in a pandemic. The whole world basically shut down. So it was important to accelerate the process. However, even in the EUA situation, the vaccine is only approved if it is safe, effective, and the benefits outweigh the risks. And so on the next slide, I'm going to show you the normal timeline for approval of vaccines or drugs and the shortened timeline for the COVID vaccines to reassure you all that safety was not compromised on. So the normal timeline is shown in blue, right? And we've probably all discussed this. Wow, it usually takes 10 years for a vaccine or a drug to come to market. And people are concerned the COVID vaccines are out so quickly. I don't think it's safe. I don't trust it. Well, let's talk about why it usually takes 10 years. So looking at the blue, when the drug comes out of the lab, the first 6 months they're doing preclinical, usually in animals. They inject it into animals just to see what the effects are in animals. And that's 6 months. And then the phase 1 trial, using a small number of people, usually takes a year and a half, right? And then once the drugs come out of phase 1, they move into phase 2. Phase 2 takes 1 year. So now you're at 3 years. And then from phase 2, it moves into phase 3, which is the thousands of volunteers. This usually takes about 2 years just to recruit enough people and to review the data. So now you're at 5 years. Now, after the drug comes out of phase 3, the data is reviewed. And this is a lot of back and forth between the drug development company and the FDA. It takes a lot of time. They go back and forth and review and re-review. And that usually in itself takes 3 years just to review the data. At which point, if the data is satisfactory, it's approved, and then the drug companies start to manufacture after this approval. However, for the COVID vaccines, we didn't have 10 years to do this. And there was a lot of support by the government here in the US and across the world. A lot of money was put into the process to allow for phase 1, phase 2, and phase 3 to take place at the same time. So what you're looking at is that within the first year, all 3 of them were done concurrently. So as they were recruiting people for phase 1, they were doing phase 2 at the same time, and they were doing phase 3 at the same time, right? So they were all overlapped. So they all took a year together at the same time. And the regulatory approval was obviously done much faster, right? It was done in 3 to 6 months. It was done much faster. There wasn't as much back and forth because of the time. But the safety was not, the important point is that they didn't cut corners on safety. They did actually try these drugs in thousands of patients, and they did actually take the time. They were also able to recruit much faster than usual because of the funding that was available. So then after, and one other thing that's important to point out is usually they wait till the end of the approval process to manufacture the drug, but because the government's put so much money into it and we're already able to order the drugs and the vaccines in advance, the drug companies actually started to manufacture the drugs right at the beginning at phase 1. So the drugs were ready to go the minute they were approved, and they were distributed immediately. And this is how this was narrowed into a year and a half. So let's think about this acceleration again, just to reassure you all that safety this was not due to cutting corners on safety. Researchers didn't start from scratch. So researchers like myself, like Monica and others who work in this space, researchers who actually work in this space, have been studying viruses like this for many years, right? So they studied MERS, they studied SARS, they understand these viruses, they had existing data on the structure, genome, and life cycle of this virus. Next. And the whole world really collaborated on COVID, right? Because it was a global emergency. There was worldwide sharing of data. We knew the genetic sequence of COVID in January of 2020. Researchers at my organization, the New York Genome Center, had access to that data January of last year and started doing a lot of research on it. And then let's talk about the new messenger RNA, mRNA technology that Monica mentioned is used for the Pfizer and the Moderna vaccines. mRNA technology in and of itself is not new, right? This is the first time it's being used for vaccines. However, it's been used in drugs in the past. There currently, I checked the FDA website, there are currently almost 10 drugs in existence today that have been approved by the FDA that use mRNA technology. So there's a drug for the condition called SMA, spinal muscular atrophy, which is a genetic condition where babies are born and they can't sit up and they can't stand. And an mRNA technology drug was approved for this back in 2017. That's been on the market for 4 years. So while this technology is new for vaccines, in and of itself, it's not actually completely new. Next. And finally, I mentioned this earlier, there's unprecedented financial support. Governments purchased allotments of the vaccines even prior to knowing its success. So this helped to bring the vaccines to the market faster. Okay. So now let's look at the data. Let's look at the data that came out of these clinical trials. Okay. So in the US, these are the 3 vaccines that are approved. There's the Pfizer, Moderna, and J&J. For the Pfizer and the Moderna, those use the new mRNA technology. The J&J vaccine uses an adenovirus vector technology. It's different. It's basically using a different viral vector that's not harmful, and then putting parts, once again, it's parts of the COVID virus in there, not the entire thing. Okay? So the Pfizer vaccine actually enrolled more than 46,000 participants. Moderna had more than 30,000, and Johnson & Johnson had more than 43,000. Pfizer was done in 150 sites across the US. Moderna was done at 89 sites, and J&J was done actually across the world, the US and 7 other countries. And one of the things that all the drug companies did that it's very important, and I'm glad they did it, is that they made sure that the racial and ethnic distribution in the clinical trials matched the normal population as much as possible. So if you look across for all 3 of them, they had anywhere between 13 and 19% Hispanics enrolled in their trials. They had 10 to 13% African Americans and about 5% Asians enrolled in the trial. So they tried as much as they could to have the racial distribution of the trials match the general public, okay? And so on the next slide, we'll talk a little bit about the data, right? So we all talk about the effectiveness, what does this mean? Well, first let's start with the regimen. So the Pfizer vaccine is given in 2 shots, 21 days apart. The Moderna vaccine is given also in 2 shots, 28 days apart, and the Johnson is 1 shot. That's the one and done, okay? Pfizer and Moderna, because they use mRNA technology, mRNA is very sensitive to temperature, so it has to be stored at minus 80 degrees. The J&J vaccine can be stored in a normal refrigerator. The Pfizer vaccine has been approved already for those 16 years of age and older. Moderna and Johnson & Johnson are approved for 18 years and older, okay? And so Pfizer and Moderna, as you can see, their effectiveness is very close. So basically about 95% effective. J&J is 85% effective. What does that mean? So let's start with Pfizer. So remember I mentioned 46,000 people in total were recruited into the Pfizer vaccine trial. The Pfizer, these 46,000 people either received the vaccine or the placebo. They don't know which one they got. And they're followed and they're monitored. And then at the end of the trial, it's unmasked and they see, okay, how many of them are sick and how many and so on. And so when they look to see how many came back COVID positive. So keep in mind, this is after getting both doses of the vaccine, you come back and you're positive for COVID. It was 170 of the 46,000. But then when you look at those 170, then you unmask and see of these 170, how many got the vaccine and how many got the placebo. Only 8 of that 170 got the vaccine. The other 162 got the placebo. So that's what we mean by 95% effectiveness. It's not 100%. It's not guaranteed that every single person who gets this vaccine will not get the infection. However, it's a very good number. It's 95%, okay, effective. And looking at Moderna, 30,000 of them received either the vaccine or the placebo. Of those 30,000, 95 came back COVID positive. And of those 95, 5 of them got the vaccine. Only 5 of the 95 that got COVID came back COVID positive, got the Moderna vaccine. So Moderna is 94.5%. And finally, J&J was 43,783, 625 infections. Of those 625, only 193 got the J&J vaccine. The others got the placebo. So these are pretty good effectiveness numbers compared to vaccines that are currently on the market. However, when you then look across all 3, and I'm going to come to the J&J news and that news that came out a couple of days ago shortly, but I just wanted to cover the clinical trial data first, right? But looking at these numbers, these are pretty good numbers in terms of effectiveness. But then when you look more closely at all these people who actually came back positive with COVID, how many of them were so sick that they had to be hospitalized and how many died? And the answer is 0. Like literally none of the people who came back positive, none of these people down here in the vaccine group who came back positive after getting the vaccine were so sick they had to be hospitalized, or none of them died. So what that tells us is, as far as the clinical trial data is concerned, the vaccines are 100% effective in preventing hospitalization and death, which is really important. And this is part of why we've been saying that, whatever you're offered, take whichever vaccine you're offered. And people are like, oh, I want the better one. I don't. All of them in terms of hospitalization and death all work equally. But we'll get to the new information about Johnson & Johnson shortly. Next slide. So, we wanted to talk about the variants very briefly today, because I knew that's something that people are concerned about. So the CDC has recognized that there are currently 5 variants of concern, or VOCs, as they mentioned on the CDC website. And this information I took right from the website. And so these are the 5 variants. There's the B117 variant, which is also known as the UK variant. It was identified here in the US in December of 2020, but initially detected in the UK. The B1351 variant was identified here in the US in January of 2021, but was initially detected in South Africa back in December. The P1 variant was detected in the US in January 2021 as well, but was initially identified in travelers from Brazil who were tested at an airport in Japan in early January. So that's the Brazil variant. And then finally, these last two variants are the most recent, 1427 and 1429. They were first identified in California in February of 2021 and were just recently classified as variants of concern in March. So, you know, the information that's available on the website, right, on the CDC website right now is that so far the studies suggest that the current vaccines, the antibodies generated from the current vaccines are recognizing these variants. So that's good news. So, you know, all the drug companies are actually testing these variants now. They were not part of the trial, but they're testing them now. And so far the data shows that the vaccines work against these variants, right? So we don't know definitively yet, but so far it's looking good. This is being more closely investigated and more studies are underway. So next slide. So now I'm going to talk about this news. If you could just click through to next, Monica. I'm going to talk about the news that came out 2 days ago. Oh, sorry.
Not that much.
too much, yeah. The news that came out 2 days ago, right? So we heard on the news that the CDC and the FDA have recommended a pause on the J&J vaccine. They've paused administering the J&J vaccine due to blood clots that have been identified in some people who received the vaccine. It's important to note in all the press releases that they state very clearly this recommendation was made out of an abundance of caution, right? So it's, you know, we're being overly cautious almost doing this, but it's because they really want to reassure the public that whatever we're doing, no matter how fast these seem to be coming to the market, we are not cutting corners on safety. And if there's a safety concern, we want to take the time to review the data. So let's pause for now, review the data carefully, and then we'll make a decision. Okay, but let's look at the numbers. So it's 6 women. I think as of this morning on the news, I started reading there might be a 7th, right? 7 women developed these blood clots 6 to 16 days after vaccination. So it's a concern. I believe one of them died. So it's definitely something that would concern people. However, let's take into account how many doses have been administered. 7 million doses of the vaccine have been administered to date. So if you're saying 7 women out of 7 million doses, you're saying it's a 1 in a million chance, right, of getting a blood clot if you take this vaccine. So the probability is 0.009 people out of every 100 that get the vaccine might get this clot. The probability of dying from COVID is 1.8 people per 100 with COVID-19, right? And on the next slide, let's compare it. If you click just once more, Monica, let's compare the risk of blood clots from this vaccine to the risk of blood clots from birth control pills, right? So J&J vaccine, let's even say it's 7 cases in 7 million doses, right? Or 7 cases out of 7 million doses, that's a it's like about 0.1%. It's a very small number. It's like 0.00009% or so on. For the birth control pill, 5 to 1,200 cases in 1 million women, right? So remember, this is 1 case in 1 million women, 1 million patients for the J&J vaccine versus 500 to 1,200 cases in 1 million women for the birth control pill. So the birth control pill is anywhere from 0.05% to 0.12%. And what about people who smoke? If you smoke, right, the risk for you to get a blood clot is 0.18%. If you're infected with COVID, the risk of getting a blood clot is 16.5%. So I think when it's taken into perspective, when we talk about benefit and risk, I don't know, I'm not the FDA or the CDC, but I think ultimately the decision is probably going to be that the benefits still outweigh the risks. Right? The benefits of this vaccine still outweigh the risk. So there's a good chance they're going to come back in a few days and continue the administration. But obviously, healthcare providers who have patients who might be at risk for clots will be advised, you know, they might advise patients not to take the J&J vaccine or tell them what symptoms to look out for. Okay, next slide. So then this next slide, before you press play, I want to kind of set the stage for you guys to look at this slide. So we talk about herd immunity a lot in this in the discussion of vaccines. What does it mean? It's important for everyone to understand what that means. What that means basically is what percentage of the population, once they're vaccinated, will protect those who can't be, right? So you need to have a large percentage of the population vaccinated, and then you'll protect the few who can't be. And I think we should think of it in terms of there's some people who cannot receive the vaccine. It could be because they're born with an immunodeficiency, because they're immunocompromised, because they're receiving treatment for something like cancer. There's certain people who just cannot receive the vaccine. Children can't get the vaccine. And even though COVID luckily hasn't been so bad in children, there are children who have died from COVID, right? So we have to think of the most vulnerable in our population who cannot get the vaccine. And how do we protect them if the rest of us who can do? Now, so in this image, the blue dots are the unvaccinated population. There's a black dot in the middle. That black dot in the middle is ground zero. It's a COVID patient, right? And then the yellow are the vaccinated people. So yellow is vaccinated. So you can see with more vaccinated people, you have more yellow in the audience, in the crowd. And so now when she hits play, you're going to see a red line start to show. There you go. You see a red line that shows the COVID spread, right? Now imagine one of these blue dots on the border is someone who's getting cancer treatment and can never get the vaccine, right? In the general population, 0, 25, or 50%, they'll catch COVID. They'll catch COVID and there's a good chance they could get sick and die. However, when everyone around them is vaccinated, they become protected. That's what it means. So she's going to press play. I think it plays one more time so you can see that again. And if you can just focus on one of the blue dots on the edges. Oh, I thought it was supposed to play twice.
I'll just play it again.
Yeah, I'd like you to play it one more time.
Once it comes. Okay.
Yeah. You can focus on one blue dot on the edge. Imagine if that's a cancer patient that can never get a vaccine. So the rest of us want to try to get vaccinated so that the immunity of the herd will protect those who cannot be vaccinated. That's what herd immunity is about. And that's why it's almost like a personal responsibility of those of us who can be to get vaccinated to protect those who can't. So the next slide. I think the next slide then talks about side effects. So of course, we all know, we've all heard, and we all have to be prepared that the vaccines do have side effects, right? And this is natural, this is normal, it's nothing to be concerned about. What are some of the side effects? The side effects are pain, swelling, fever, chills, headache, and fatigue. I can tell you, I've been vaccinated. I got the Pfizer vaccine. After my first dose, I was tired. That was it. After my second dose, I had some pain in my upper arm, right? So it says if you have pain, you can apply a cool rag. You might have swelling. If you have swelling, you should use or exercise your vaccinated arm. If you have a fever, you can take Tylenol. That won't interfere with antibody production. If you have chills, a lot of people do experience chills after their vaccine. Stay hydrated. They recommend you get hydrated before you get the vaccine and stay hydrated throughout. If you have a headache, you take over-the-counter medications. And if you're tired like I was, you rest, right? So these are things that, if you expect them, you can be prepared and you can handle them. Now, the next slide will compare this to the actual symptoms of an infection. If you get the COVID infection, you can have a cough, shortness of breath and difficulty breathing, fever or chills, muscle body aches, vomiting or diarrhea, loss of taste or smell, and worst case scenario, you could be hospitalized, need a ventilator, have long-term chronic pain, or die. Like so many people have died from COVID. So when you compare the side effects of the vaccine to the possibilities with the COVID infection, I think it's pretty clear that the side effects of the vaccine are worth it if it's protecting us from hospitalization or long-term death. And on the next slide, I think we talk about it shows how many people have died. So this is the COVID dashboard from the Johns Hopkins website. It shows you, as of, I pulled this on April 12th, as of April 12th, 136 million global cases of COVID, 2.9, is that those numbers right? Yeah, 2.9 million deaths and 562,000 deaths in the US alone. So 562,000 people have died from COVID. So I think it just shows strongly how we all need to protect ourselves from this virus. Next. Right, so these are some of the reasons why some people have declined the vaccine. We know there's a lot of hesitancy out there. A lot of people are hesitant, they don't want to get it. Some people are concerned about side effects. I think it's clear that the benefits of the vaccines outweigh the risk. Some people think the vaccine may not be safe. I think the FDA and the CDC are showing us that they're taking safety concerns seriously, and they're trying to show the public that. Some people believe in leaving nature to take its course. Some people don't think COVID is dangerous to my health. I know from those of us, we live in the New York area. We saw the news last year when there were like freezer trucks outside hospitals for bodies. People are dying, it's real. Some people are scared of injections or believe in natural or traditional remedies, or for religious reasons do not want to take the vaccine. Our hope is that, as you listen to this, you go out in your community and convince people to take the vaccine, and also that you will take the vaccine, right? So this slide is really, asking why should we take the vaccine? So for communities of color, I pulled this from the CDC on March 12th. If you click through a few times, there are a few red boxes that show up. I want you guys to focus on this, right? What this data is showing you is what are the rates of death and hospitalization in Black or African American people or Hispanic people compared to white people. So so basically the rates are 3 times. A Black person or a Hispanic person is 3 times more likely to be hospitalized from COVID than a white person, or 2 to 2.3 times more likely to die from COVID than a white person. I think these are strong numbers. And if you click one or two more times, as you look in the American Indian or Alaska population, theirs are even higher numbers, right? So they're 3.7 times more likely to be hospitalized than a white person, or 2.4 times more likely to die from COVID than a white person. So I think these are strong, compelling reasons why we should all take the vaccine. Next slide. All right, so Monica, you want to take the first one?
Yes, so we also want to start discussing what you all might have heard already about the myths about COVID-19. One of them is that the COVID-19 vaccine enters your cells and will change your DNA, and therefore will change you or your composition. And the truth is that this is not possible. And the best analogy we can use is if you were to think of a bank. So the mRNA is going to be like when you go to the bank, you can only go to the lobby. You're not going to be able to go to the safe of the bank and just go and take the money, right? So the mRNA is the same way. So I know we wish we could, but no, we can't.
Good example, though. I mean, makes it clear.
So it makes it very clear. So
yeah.
The mRNA can only go to certain part of your body, give the information that your body needs to make the antibodies, but it cannot enter or change your DNA because your DNA is so precious, so it's not going to change anything.
Mm-hmm. All right. So this is the next one is the COVID-19 vaccine will impact fertility. So this is another one that I've heard a lot and it concerns a lot of people. But the truth is this is not possible, right? The genetic materials do not change upon exposure to the virus or the vaccine. There is no impact on ovulation or spermatogenesis, and hundreds of women have gotten pregnant post-vaccination, including from within the clinical trials. So this is not true.
So another thing we heard, measles, mumps, rubella vaccines and other vaccines cause autism. So we all heard this about people against general vaccines. However, the truth is that the article that made this claim originally many years ago was considered and retracted because it was considered fraudulent. What it means is that there were subsequent studies that actually disproved this link of autism and vaccines. So they look at millions of patients and they saw there was no causative or correlative link between autism and any vaccine. So this is very important.
The next myth that people are saying is, well, I already had COVID, so I don't need the vaccine. I had COVID, I'm protected. Well, that's also a myth. The truth is you can still benefit from the vaccine. It is unknown how long one is protected from getting sick again after recovering from virus exposure. So there are certain things that you really can't know until time has passed, right? One of them is, how long you're protected if you got COVID. The other one is how long you're protected with the vaccines themselves, right?
So another myth, and this is, we all heard it, right? They will microchip me and they will track me when I get vaccinated. And so the truth is, this is just not possible. The smallest microchip that is known are going to be the size of a grain of rice. And that will be much bigger than the size of a needle. We will need a pretty big needle to be able to do that. And also, if we think about it, we can be tracked much easily with our cell phone. So for those that are concerned about being tracked, just remember you have a tracking device right next to you, but not the vaccine.
All the time, yeah. All right. The next myth is that the coronavirus vaccine gives you COVID-19. So I'm hoping that from our presentation that you guys, from the way Monica explained how these vaccines are generated, that you can see that that's not the case. The vaccines do not contain the virus. They have pieces of the virus that your body recognizes and builds immunity against, right? Like we said, it's like we're trying to trick the body into thinking it's been exposed to the virus, so it produces these antibodies. But those pieces cannot make you sick. Okay.
The next myth, if I get vaccinated, I can stop wearing a mask. And the truth is that no, we still have to observe the same caution, the mask and any other of the rules we heard, the social distancing, because those around you may not have been vaccinated yet, as we explained before. They are exposed, they are at risk. As vaccines prevent you from getting sick, but they are not preventing the virus from entering your body, meaning you can still have it and give it to other people, even though you are not going to get sick. So it's important to keep wearing your mask.
And the next one is, if I get the vaccine and I'm undocumented or an immigrant, the government will deport me or I'll never be able to get a green card. This is true. New York State and most other states will not and has not reported any data to the federal government other than an aggregate. So all identifiers will be removed. There's nothing that can identify you, your name, your date of birth, that's all removed. Immigrants and undocumented New Yorkers can get the vaccine without repercussions.
So the next myth, the COVID vaccine was created too quickly and therefore is unsafe. I don't want to be experimented on. So I think by now, based on what Banky showed us about all the precautions that the FDA takes and all the regulations, we know that the vaccines were each tested in more than 40,000 people, and they were not approved until safety was assured. And importantly, she also talked about the example of the J&J vaccine, which has right now it's in pause, again, just to be cautious and make sure everything is safe for the population. So now, to date, they've been giving more than 60 million doses across the US. And this,
I think it's even like 120 million now, right?
Yeah, because that was back in February,
yeah.
This number. So, and actually the US is doing great compared to the rest of the world so far in the number of people vaccinated.
Mm-hmm.
So,
okay. So we're just going to, give you a few other bits of information that are important and resources. So, when you do get the vaccine, there's this website that you go to report if you suffer any adverse events, right? You report it so that the authorities are aware of it. And that's probably how they became informed about the women with the blood clots. Next. So looking at the adverse events that came out of the trials, there were 3 SAEs, that's what they're called, serious adverse events that were reported in the vaccine group. One was a 65-year-old man in the community who acquired pneumonia 25 days after vaccination. One was a 72-year-old with arrhythmia after being struck by lightning 28 days after vaccination. And one was an 87-year-old with a worsening chronic bradycardia 45 days after vaccination. They get this information, they review it, and they see if it's related to the vaccine. And upon review, they determine that none of these adverse events were related to the vaccine. And if you click once more, you'll notice that one of these people died after being struck by lightning, right? So there are definitely adverse events that are reported that gets people concerned. But it didn't have anything to do with the vaccine. And so this is why they're pausing as well to look at these blood clots, right? You have to actually determine whether it was related to the vaccine or not, and then figure out, how relevant it is. Next slide. So now we're going to give you names of a few websites to get reliable information. It's important if you want to learn to go to reliable sources. YouTube can be misleading. Googling stuff, asking on Facebook can be very misleading.
Hey, don't say that. We're going to be on YouTube.
No, YouTube is good, but
except for this.
So the cdc.gov is a good place to get information. Next slide. There's a COVID-19 web page on the NIH. So covid19.nih.gov is a good place to get information. Next. The New York City.gov coronavirus website is a good place for reliable information. Next. And the coronavirus Johns Hopkins website, that's where we got that dashboard from on the global cases. That's a good place for information. And then I think next is for scheduling your vaccine. So hopefully we've been able to convince you guys to, if you haven't, to go out there and get your vaccine appointment and tell your friends and family to do so. You can go to the vaccinefinder.nyc.gov website. And I think there are about a few more. That website can be translated for those people who need translation help. A few more sites here. I think click again. This is covid19.nychealthandhospitals.org. Next slide. And then this Vax, VAX4NYC.nyc.gov. You can click on it to schedule your doses as well in the New York City area. And I guess you have to say what your classification is. And then this somosvaccination.mdland.com is another place where you can get COVID vaccine appointments. TurboVax is another website you can go to. And that's it. This is the last slide. So on this slide, we really need to acknowledge the people who put together this coalition of us who are out there presenting about vaccines. Their names are across the bottom: Abraham, Chris, Scott, Kiara, and Ushma. They're from Sloan Kettering and I think a couple of other institutions. And they put together this content and we must acknowledge them. And that's it. Thank you.
Oh, thank you so much, Dr. Monica and Dr. Banky, for your patience and your expertise. We were supposed to have this earlier last month, and we're just getting to it. And this has been a very informative and thorough and comprehensive and up-to-date presentation of what is going on. And I hope that people are able to walk away, I'm sure they are, with a lot more information than they started with. And again, I appreciate your taking the time to be with us. We do have the council person from the health committee, council person Mark Levine, is going to follow up with some New York City policy information. But before that, what we'd like to do, if in the chat, if anybody has any questions for the doctor, please let me know now so we can, please raise your hand and we can get the information to you. Okay.
And everyone, the chat comes to me. This is Lucian, I'm the host. So what I'll do is I'll collect any questions that come in and I'll turn them right around to the doctors. And that way they have them all in one place.
Okay. So I see two hands raised, and so I will start. We'll take these two, and then we'll move on. Bob, the first one is Bob Schneck. Bob, go ahead.
Okay, I'm trying.
Okay, we hear you.
Damn it.
Heard that too.
Come on.
We hear you.
Okay, well, I'm not visible as intended, but in any case, my first question is, I've been hearing from a lot of people about booster shots. Are there going to be booster shots for this, or do we expect that we have to react to the variants and things over time? Is there something in the works for this? And also, I've been reading about how you can have a Moderna shot and then some other kind of shot, and they're being mixed up a little bit. And then I want to find out if that's something valid or something that's just being tested.
Okay, thank
so
you.
I can try on this, and then Monica, you can add if you have more. So I think these are both questions that are currently under study, right? We don't at this time know yet if there will be booster shots will be needed. Unfortunately, those are things that you can't take shortcuts on time. You have to wait, right, to see how long the antibodies last, right? And it's not been long enough at this time yet to say whether or not they'll last. So if they do find out in a year that, or later this year, that, well, the antibodies aren't lasting that long, there is a good chance that we might be required to take boosters. And the second question was whether you can mix and match. That's also something that's being studied. You know, they're studying that to see if that's something that will happen. That hasn't been approved yet, but it's definitely under study.
I wanted to have you comment on why it's important for the whole world to solve this as a problem, not just the United States, not just Europe. The whole thing has to be straightened out. And I have some ideas why that's important, but you can actually explain it.
So before we go to that, I just want to quickly say that, for example, since for the Pfizer vaccine, and that's been 6 months so far that they've been administered, so far they have shown that for 6 months people still have immunity. So again, like Banky said, time is the only way that we're going to be able to tell things, and because all of these. So the way the immunity works, we are generating antibodies, and only again with time we're going to be able to know if you can mix and match, and whether or not getting a vaccine from a different type of antigen will increase your immunity or is going to decrease it. And that's something, again, only time will say. And then you were mentioning you wanted to the second part, you were mentioning you wanted to know how to get everybody involved. I didn't understand that.
I was talking about internet, how that it's important for everyone in the world to be vaccinated, that it isn't just for Americans or Europeans.
Everybody.
In order to make the world healthy, we have to make everyone healthy.
Of course, because as Banky showed, I mean, we all travel. The reason that this is a pandemic is because we travel. And it's very easy to transport the virus in our bodies because that's how the virus survives. So it's going to be critical that the entire world gets vaccinated, that the entire world gets protection. And I think we're underway. Everybody has different access to different vaccines. But Banky also mentioned in the beginning, if you get offered a vaccine, take the vaccine. And in other countries, they have access to very different vaccines. And as long as people get vaccinated, is the faster the entire world gets vaccinated, the faster we all as a society can go back to hopefully a more normal life, but only time will tell.
Okay, next question, Diane. Diane Stein.
Can you hear me?
Yes.
Yes.
Okay, I had actually two things that was on my mind. One is what is gonna happen with the program for homebound people now that the J&J vaccine has been.
Oh, I think Mark Levine might be better able to answer that, and he's waiting to make a presentation, I believe.
And then I had a second.
Go ahead.
Is there any like a comprehensive database? Like, let's say somebody has dementia and they may not remember if they've gotten the vaccine or which one they have. Is there a way to track that, or somebody may lose their card? Is there any? And because there are different sites, there's New York's, there's a city, there's a state, there's FEMA, there's pharmacies. You know, is there any one central place where you can say, oh, yes, Joe Smith had gotten the Moderna vaccine on February 2nd or something like that? And
that sounds like that might be another question for Mark Levine, and which he's waiting to present. Okay. So with that, again, I would like to thank the doctors for their time, and like I said, the most comprehensive and thorough presentation that is memorialized in our recording on YouTube. So I know I will go back and look at it again because it was a lot of information, especially in terms of the variants and the different types of things that could happen to the body is important. Okay, thank you again, Dr. Guzman and Dr. Fagamini, for your time and your information.
Well, thank you very much for the opportunity.
Yes, thank you. Thank you very much.
Thank you.
Bye.
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 Okay. Lucian?
Hi, Francis. Yep, we have Mark Levine with us. He's already on.
Hello, Chair Curtis.
Hi.
Hello, Madam Chair.
Yes. Hi, Mark.
All right, can you hear me okay?
So,
okay, great.
I'm sure you heard some of the questions
Sure did.
that you might be able to answer. And okay, so the first Diane's question. You want the questions again, or do you remember what they were?
Well, I think there were the two that I remember is a question on what's going to happen to home vaccination now. And what happens if you lose your vaccine card, and the question of a central database. And
somebody please mute. Somebody is
there,
okay. Go ahead.
But let me just thank you, Madam Chair, for what incredible leadership you have displayed on health matters for CB1 and beyond, and for convening this important discussion tonight. And I don't know if the doctors are still on, but my goodness, what an incredible presentation.
Yeah.
I was glad to hear you say it's all going to be archived, that we can retrieve it and show it to other folks. And
yeah, I got that from Uma, from our Uma. Ushma?
Ushma, exactly. That's
She's
great.
Yeah, she's on our calls. Yeah.
She's wonderful as well. And I'm happy, we scheduled this a while ago, but I'm happy that we are speaking tonight, because New York City is really at an inflection point in vaccination right now. And in good ways and ways that are more challenging. And I want to update you because the events are really changing rapidly, not only because of Johnson & Johnson, but more. For the last 4 months, our biggest challenge has been managing a crush of demand for appointments and a very disjointed and difficult to navigate system online for getting your vaccine. I'm sure many of you have suffered with that. But in the last 2 to 3 days, we've had a real shift where all of a sudden appointments are very slow to fill. And appointments at very popular sites like the Javits Center, and appointments in smaller community-based hubs around Manhattan and around New York City. And that is, on the one hand, great news, because it's going to make it easier for those of you or those who to get their vaccine. On the other hand, it's reflective, I fear, of a slowdown in people who are actively seeking out their vaccines. And I think that we're going to have to, in this new phase, work a lot harder to get vaccination to people where they are, and to do more to build confidence in the vaccine, which is why I'm so grateful that this committee tonight has spent time answering so many key questions. And the way we're going to be able to do that is by taking vaccine to homebound seniors. Great question on that. Taking vaccine to community centers and NYCHA developments, taking it to houses of worship, having mobile vaccine vans, vaccinating in private doctor's offices where there is a lot of trust, where people have familiarity and they're located in our neighborhoods. Unfortunately, almost all of those programs to some degree have been relying on Johnson & Johnson for logistical reasons. It's one dose, there's no ultra cold storage for a variety of reasons. Every one of those programs, which are designed to bring vaccination to the people, has been built on Johnson & Johnson. I think most famously homebound vaccination, which was already moving a little bit slow. We've done about 6,000. The waiting list, I think, is more than 100,000 at this point. But nonetheless, a great program, which I think we all support. The official line currently from the city, the Department of Health, is that, well, they have paused homebound vaccination, and that their hope is that some form of Johnson & Johnson will be restarted soon. And we don't know what's going to happen. It's possible that there could be a recommendation that Johnson & Johnson be simply reserved for older folks, because there have not been any reported cases of people above, I think, age 50. And that could work out, but it seems that they're not moving particularly fast to resolve this at the federal level. It seems like we have at least another week to wait. And I really strongly believe that when it comes to homebound vaccination and many of the other special programs I described, we're going to have to find other ways. And there are other parts of the country that are using Moderna, which is a little easier than Pfizer because it doesn't have to be so cold. They're using Moderna for homebound in other parts of the country, and they were prior to J&J, and also using Moderna on mobile vaccination. Again, prior to J&J. It's more complicated, but I think we don't have a choice but to find alternate solutions. So And just very quickly, I'll address the question of the vaccine card, which I'm proud to have one now. I got my J&J on Friday, as luck would have it. First of all, everyone should take a picture. If you have a cell phone, take a picture with your phone so you have an image stored. But the official answer is if you lose your card, you should go back to the place where you got vaccinated, and they should be able to reproduce it. Anecdotally, I know that has happened some at chain pharmacies and city hubs. But there's also a centralized database for vaccination that the city has. Did you want to ask something about that, Chair?
No, just that with the Excelsior Pass, because you have,
Right.
so when I went to register for that, it already, all I had to do was put my name in and automatically everything came up. So
Right.
it answers the question in terms of a database that has everything, because I didn't have to put anything about my card in
Right.
there. So
But the city
that's
has
another
had
option.
for a long time something called the Citywide Immunization Registry, CIR. And so that's everything from flu shots to whatever other kinds of vaccinations you would get. But it was ready-made to put into action for COVID vaccination. So it is treated, just so everyone knows, as extremely sensitive healthcare information. This is not the kind of thing that some random city agency or random city employee can just access and find out whether you have been vaccinated. It's not the kind of thing where, I don't know, Citigroup could say, can you tell us which of our employees have been vaccinated? No, that's not how it works. This is treated as very privileged, secure healthcare information. So people really should have confidence in that. It's not shared with immigration authorities, et cetera, et cetera. But yes, the Excelsior Pass is plugged into that. And, I think we can be honest about some folks having concerns about that. And we could probably spend a lot of time about the pros and cons of that from a civil liberties perspective and elsewhere. But it is likely that for entertainment arenas, for airplane travel, possibly even for some work settings, that vaccination will be required. For now, to the extent that's done, your good old-fashioned paper card is good enough. For example, to go to a Yankees game, or the Excelsior Pass, but actually also proof of a negative COVID test if you haven't been vaccinated. So that's a bit of the big picture. And Madam Chair, my schedule's a little bit funky tonight. I have a speaking engagement that might be in as soon as 6:15. That would be quick. Another event that I could potentially come right back on. But maybe if you wanted to, if there are any questions in the chat or any questions you have.
There is. I
Okay,
see
great.
Pat Moore has her hand up, and she's the
Okay.
chair, and we're going to go into her meeting
Right.
after this. But I'd like to
Right.
thank you for taking the time to be with us. And
Pleasure.
we'll talk, because maybe we need to do this recurrently.
Well, I'm happy to
So
do that as well.
we will make that happen. Okay. All right. Thank you very much. Go ahead, Pat.
I just wanted to ask, did I hear, can you hear me?
Yes. Hi, Pat.
Hi, how are you, Mark? I just wanted to ask, did I understand it that you could go back to the place that you were vaccinated and they would be able to reproduce your card?
That's the official guidance. Yes.
Okay, but if, say, you went to York College, I mean, that's a big, big facility, would they be able to reproduce your card?
Officially, they should be able to, yes.
Okay, all right. So Javits Center, any of those places, I can just recommend to people they go back.
Yes, that's right. Now, the city also had, there may be other solutions coming soon. The city has an existing web page, I think it's called My Vaccine, that you can check your own vaccine status, for example, like flu shots or MMRs for your kids. And they are, I believe, working to relaunch that for COVID vaccines, which might actually allow you to just print out from the My Vaccine webpage proof of vaccination. That's not yet entirely ready to be rolled out for COVID, but I think it's coming soon. And that would avoid the hassle of having to do things like, go back to York College. And just as the chair was mentioning, if you use Excelsior Pass, which I'm not necessarily recommending, we can talk about the pros and cons, but there you don't actually need your paper card. So there are multiple solutions if you actually lose the actual paper document.
Thank you.
Thank you, Pat. And thank you, Pat, for what you're doing on quality of life stuff, or I should refer to you as Madam Chair in that context as well. And something I care a lot about, in which, if I can, I might even come in just to hang out on your, I know you have an important committee hearing on that
Please,
topic tonight.
Anytime you are welcome, please.
Well, I appreciate that. Thank you.
I don't know if Bob Schneck's hand was up for Mark, or was it he just didn't put it down from the.
I
members
have
probably
have
don't have
another
time for,
question, if there's time for it.
Mark, do you have time for one more question?
Yes, absolutely.
Okay.
Because
Okay,
you
go ahead,
have
Bob.
you have a lot of experience kind of working with the public and answering questions. I'm really expecting that the Johnson & Johnson product is going to be cleared for vaccinations, but everyone now knows that they had 6 blood clots in Europe and 7 in the United States, and that's just going to scare people. So now we have a major drug that's available, but people are going to be afraid of it, even though it's 6 or 7 per million or 10 million. So how would you answer questions like that if it does get cleared, or if where we encounter, statistical realities that are very tiny, but people
Bob,
are
and I'm going
very
to interrupt
frightened?
because they're waiting for me in the next thing, and so I'm going to have to leave in just a few seconds. Happy to come back and talk about this. All 3 of the vaccines remain extremely effective and extremely safe, and this regulatory process has worked to prove that they care about safety, and that even that adverse impact, which is as rare as what we're seeing with J&J, is getting serious treatment from the federal government. So my message is, this proves that safety is first and foremost, and everyone should get vaccinated. And I'm so sorry I have to jump off.
That's okay. Thank you very much.
Thanks,
That's a
everybody.
great
See you
message,
next
and
time.
thank you for it.
See you.
Bye-bye.
And Bob, that question might have been for the doctors when they were on, but hopefully we'll be able to get them back, or have some presentation on some other issues that will probably surface between now and then. So again, I'd like to close this part of the meeting out and turn it over to Pat, and tell all those people who just logged on. I'm sure you'll be able to see a wonderful, very dynamic and thoughtful and comprehensive presentation on vaccines, variants, and the vaccine trials, which was presented earlier if you logged on later. Okay, all right, I'm out, Pat.
Listen,
okay. Just let me turn off the recording really quick.